Hi everyone, this is Loic. Thank you for watching my presentation. This presentation is on GEMA. As most of you know, I launched GEMA last year in order to bring awareness and solutions to African healthcare issues. I've launched several initiatives, but this presentation is focused on the mobile applet initiative. The goal is basically to improve healthcare in Africa because there are several ongoing threats to African healthcare. Many families fail to recognize symptoms with severe consequences, and so you see that diseases like pneumonia, Ebola, malaria, HIV, and even stroke are killing several people every day. Sangu Delhi actually mentioned this during our course. Africa carries 24% of the global disease burden, yet only has 3% of healthcare workers. However, despite that, there's also an opportunity in Africa. Mobile penetration is rising rapidly. In fact, according to this chart, which I got from one of the presenters that spoke to us during the semester, in sub-Saharan Africa, mobile penetration jumped from 2% in 2001 to over 50% in 2011. And as we saw in Ghana, the mobile penetration is over 100% in some countries because people have multiple phones. So I saw that there was an opportunity to leverage the mobile penetration rate in order to improve healthcare issues. And so I designed a solution that would work in this scenario where a person with a sick relative would be able to access the app, get access to symptoms, risk factors, and at-home suggestions of things that they can start doing for the patient while they wait to see a doctor. This solution was wonderful because a lot of hospitals are located far from patients, and so patients often have to take a few days to raise money to get transportation to a hospital. So this solution was perfect because it allowed patients to have access to a tool to empower them to take care of their families while at home, while waiting to see a doctor. However, there were also a few roadblocks that I ran into. I realized that my solution wasn't targeted for a particular market. We saw from this semester that companies like Asoko and Sproxil and all these different companies were focusing their solution on a particular market segment. For example, Asoko was only focused on farmers, not all Africans, and that's something that I needed to figure out. I also saw that there were some unforeseen roadblocks. For example, literacy was an issue that I didn't foresee, and smartphone penetration was also an issue that I didn't foresee. Companies like Asoko overcame these roadblocks by creating a health line, as well as focusing their solution on SMS to reach that target population. I also realized that I needed to create a solution with localized content for every country. From speakers like Sangu Delhi, realized that although there's countries in Africa have many similarities, there are also several differences between the 54 countries of Africa. Nonetheless, through this course as well as through the field study, I was able to refocus my solution in order to reach my target population and effectively serve their needs. And so I redesigned the mission of this app in order to fit those findings. Basically, the goal of the app will now be to provide healthcare services to Africans living in rural areas through a mobile applet that will empower them to recognize, mitigate, and prevent top medical diseases that kill Africans daily. Through this field study, I was able to discover what my target market actually is. And I realized that in order to figure out which country to enter, I needed to figure out which country would most benefit from my solution. I initially wanted to start off in Cameroon because that's where I'm from, but I realized that wasn't necessarily the smartest idea. My solution needed to focus on countries that have high mobile penetration rates, high mobile literacy rates, as well as high disease rates. Based on my research, I found out that Kenya, Ghana, and Nigeria were perfect countries to start off in. And I've realized that several companies like Sproxil and several other companies that we've learned have focused their solutions on these countries for different reasons. However, in my opinion, these countries have high mobile penetration rates, have high mobile literacy rates because people are already using mobile phones for banking, for farming, etc. And so my solution would be well received in these countries. Now I needed to take this thing a step further and figure out which particular market I was reaching. I realized that although healthcare issues affect many people in Africa, the group that is most primarily affected are the people living in the poor social classes. And so this makes up about 70 to 80% of the population in many African countries, because these people lack access to healthcare, access to hospitals, and they suffer from the majority of the disease burden. These people most likely are farmers and miners. They're most likely illiterate, and their average monthly income is about $175. These people mostly use feature phones, and so the solution needs to be focused on JavaScript, SMS, USSD, as well as interactive voice response. Many companies that we've studied, such as Asoko and Fortix, SoftTribe, and even more MNOs that we visited, have designed solutions for these particular markets using SMS, USSD, interactive voice response, and JavaScript. And so I know that there's a possibility to create a solution for this particular market. From the overall market research that we did on the field study, I realized that I needed to have two solutions. The first solution would serve hospitals, because at hospitals there's also an overcrowded issue where there are more patients than there are doctors, and so oftentimes people come in the morning and they stay at the hospital the whole day, and sometimes they don't even get to see a doctor on that particular day. And so there's a need for a solution that would allow patients to start trying to identify what it is they're suffering from while waiting to see a doctor. And so I've designed a smartphone app that would be able to be used in these hospitals, and it would allow patients to access symptoms, suggestions, as well as more information on what diseases they might be suffering from. This solution would allow us to facilitate the recovery process, because if patients have a better idea of what they're suffering from, then they could better explain it to the doctors and facilitate the recovery process faster. However, this solution would also allow us to create value-added services for the hospitals, because it would allow us to track which patients came in, what days they came in on, what time they were seen, as well as what illnesses they were suffering from. So now we're able to create an electronic database or patient record for the hospitals. This solution would also allow us to create customizable content for particular countries where we visit. So although our solution will initially start off focusing on the top 5 medical illnesses in Africa, in each country, with these local booths at hospitals, we'd be able to track what diseases patients are coming in with the most. And for example, if in Kenya, if at a hospital in Kenya, most of our patients are coming in with suffering from stroke, we'd be able to focus our solution and develop more stroke content and push it out to people in remote areas. This brings us to our secondary solution, which is the feature phone app. The feature phone app would leverage a cloud-based solution using SMS, USSD, and interactive voice response to reach mobile users in remote areas. Basically, from the hospitals, we'd be able to generate content on which diseases people are suffering from the most, and then we'd be able to push that content out to the feature phone users, and so from their home they'd be able to access tools and data to help them recognize top medical illnesses, help them mitigate them, as well as help them give them suggestions on preventive care techniques against these medical illnesses that they can use from home. Lastly, I want to share with you a few screenshots of the prototype mobile application that I've developed. This is the initial app that I had developed. I realized that this was a smartphone app, and a lot of my target population doesn't use smartphones. However, this solution can still be used, because at the hospitals, when we create these booths at local hospitals, we can bring in these tablets or these smartphones with this particular app. And people would be able to access symptoms, tutorials, as well as gain more information regarding what illnesses they might be facing. However, we still need to develop a solution for feature phones. because the remote areas, the people living in remote areas that we're ultimately trying to reach, will be accessing the app through feature phones. This is possible because we've seen companies like Asoko develop solutions like this, and based on my conversations with a few students at MEST as well as people outside of MEST, I realized that this solution is possible. It would just cost a lot of money. It might cost around $30,000 to recruit coders to code it and make it available to the market. So the current app that I have is compatible with Apple, Android, and we're currently trying to develop a solution for feature phones. The app focuses on stroke, HIV, malaria, Ebola, and pneumonia because these are the top 5 medical illnesses in Africa, and the app is in English. However, as we move into our target countries, such as Nigeria, Kenya, and Ghana, we'd be able to expand this solution, and expand the illnesses in our catalog, as well as expand the languages to adapt to the particular countries where we're visiting. I realize that also implementation will rely on multiple partnerships. We've seen this throughout the semester as several of the companies that we've visited have established several partnerships in order to launch themselves. In my case, I need to partner with hospitals, telecom companies, media, and different organizations. And as we move into different countries, we'd expand this list to include different organizations. And ultimately, the goal is to save more lives. This project has the potential of affecting many lives of many people around the world. And thank you very much for watching my presentation.